All right, well, good morning, everyone. Welcome once again to another one in the series of Detroit Regional Chamber Tele-Town halls that we have been doing now for 3 months in response to the COVID-19 crisis. I don't think any of us thought when we started this 3 months ago that we would still be sitting here at our dining room tables, but we are. We are happy to be able to bring you chamber members and businesses across Metro Detroit and the state valuable information to help you as we continue to battle this virus and work towards reopening, which I know a number of our businesses have been doing, particularly over the last week and a half, which is great news. We have today with us a really special guest who I think is going to be able to provide lots of insight, lots of information for the folks who are listening in. Sean Egan. Sean is the Deputy Director for Labor at the Department of Labor and Economic Opportunity for the state of Michigan. That was the job he was hired to do. But in the last 3 months, he has had an additional responsibility added onto him. He is a director of COVID workplace safety, which, you know, like many of us, has had new responsibilities thrust onto him. So Sean, thank you so much for joining us here today. And why don't you just start by explaining to us what are your new responsibilities as the director of COVID workplace safety at LEO?
Sure. Well, good morning, Brad. It's really nice to be with you all today. As you mentioned before we started, we're competing with the governor's press conference today. So hopefully whomever needs to see that is seeing that, and whomever's here is here. And I appreciate the opportunity to talk with everybody. So as hopefully everybody saw, about a week ago, I was appointed by the governor to act as the director of COVID workplace safety. And one of the things that we have been doing all along in my role prior to this, including this, was overseeing my Osha workers' comp, wage and hour, and the Employment Relations Commission work. And as we all know, my Osha is going to continue to be probably the primary vehicle, not probably, the primary vehicle as it comes to workplace safety, because that's what they do. So we've been building a lot of great tools over there and doing a lot of great work. And one of the goals of the governor was to ensure that while we are doing what we do, we're coordinating across the state of Michigan and doing a lot of outreach to hear from the community on what's happening on the ground, what other agencies may be doing, and what tools may be available. So I'll be spending a lot of my time continuing to work with my Osha and others that I have dealt with all along, as well as other agencies and groups to help put the resources in place to ensure that we can do this. And I said in my speech, and I believe it, I do believe that we can do this, that we can reopen safely, but we all have to make a very strong commitment to many pieces of the puzzle. We already know, seeing in other states that were ahead of us in reopening, that they're starting to see some spikes in cases. There's a lot of reasons for that, and it's not all because people are going to the barbershop, but it is something that we need to be aware of, and we need to make sure that Michigan leads the nation in how we do this and how we do this responsibly to our communities. So real quickly, just a reminder, so COVID-19 is a novel coronavirus, which means none of us have the immunity for this thing, that if we're exposed, more than likely we're going to become sick. However, we do know that according to the science, some 35% or higher may be carrying, may be able to transmit, but may never show symptoms. Another percentage is going to have mild symptoms, and some people, unfortunately, are going to have the worst outcome, which is death. And we've seen that for thousands of Michiganders so far. We don't want any more of that. I know you don't, I don't, none of us. We want to protect our communities. So the primary mechanism for this thing to spread is respiratory droplets. And what that means is that when we talk, we have aerosols and droplets coming out of our mouth. And once that lands on another person or a surface, it can cause infection. And we also know that if you sneeze or cough or something, that's going to be even more propelling out there. So that's why we're seeing those things like the 6 foot of social distance. give gravity some time to take those things to the ground or to some other surface, which is why we'll talk about hands real quickly, or face covering. Now, we know in Executive Order 115, the governor required that anybody that is medically able must wear a face covering when they're in public. And keep in mind that that face covering, those cloth face coverings, are designed to protect you from me. They're not designed to protect me from you. So they're not actually PPE as we would think of them in the normal sense for an employee, that it is providing a level of protection to the employee. Certainly there's some quality to it, but by and large, it's intended to keep me from transmitting the virus to someone else. And when the governor says in public, the reason for that is that more than likely, I know that all of you are trying to make sure that you put the markings on the floor, that you're encouraging social distancing in your establishments, and you're doing those things. But just as human beings, and myself included, we will invade each other's space from time to time. And if we're both wearing those face coverings, the risk of transmission drops precipitously, so substantially that that's really what we're seeing in science as one of the keys to this whole operation, that if we're going to open, we need the face coverings. And another part of that order allows businesses to decline service to those that are not wearing face coverings. And I want us all to really start pushing toward a commitment, a chorus of saying no shirt, no shoes, no mask, no service in this establishment. Now, keep in mind, we do not want to push that to the point where it creates hazards. We know, and we've seen in public already, that there are some people that are going to refuse to do this no matter what. And we don't want people getting hurt because that person is going to push their way in the door. But if we can get some of the science we're seeing now, if we can get to 80%, 80+% participation in this, we can really start to contain that spread of COVID around our communities. And the only way we're really going to be able to do that is if we commit and businesses commit to saying that no shirt, no shoes, no mask, no service, and really encourage the public to participate in this process. There's a lot of confusion. There's a lot of different news going around on how it's spread, what the face coverings mean, and different things. But by and large, the science on how this does spread and why social distancing and these coverings are so important has not changed throughout this crisis. And that's going to be critical to making sure that we can keep our economy open. Because as we all know, the worst thing that we can possibly do is have fits and starts. That stages of reopening, that Safe Start plan for Michigan moves in both directions. And I'm sure that you all know very well our governor is not afraid to protect Michiganders by moving us back to a more restrictive flow if that's necessary, if the science says that's necessary. We've seen a huge drop. The governor saved countless lives in Michigan through the stay home, stay safe order. Now it's on us to trust and respect each other enough to take that forward as we reopen, to wear these face coverings and maintain social distancing. So a couple of the pieces that you need and want, we have been putting up for a few weeks now. If you go to michigan.gov/COVID workplace safety, our MyOSHA team and our communications team at Leo has been building out guidelines. I know that many of you probably participated with the work groups, and those guidelines are available either on LARA or Leo's homepage. The guidelines we've posted here are the ones that were created by MyOSHA in the coordination with our comms team that will focus in more a touch on some of those required practices, where the other guidelines include a lot of best practices. What we really want to see to the best of your ability is to move toward being the best of the best of the best. And we are trying to identify those best actors across all industries so that we can highlight them too. Yesterday, I heard that one of the barbershops in Detroit has a thermal scanner when you walk in. We know not every barbershop can do that. And it's hard and fast that you're wearing a mask if you're in this joint, which is key to making sure that we can do these things. So on that website, we have general industry guidance, which applies to everybody. So if your industry has not been specifically named in one of the executive orders, that's the one you want to focus on. And then I would encourage you to check out one that you feel is similar to your industry. If your industry has been specifically named in those orders, which are a lot of them, we have specific guidance for your industry posted on that site. And it will include the executive order language, the CDC guidelines, which Osha has been enforcing from the beginning, that you should rely on to make sure you're doing the right things. One of the other keys to this is the health screenings. Everybody has to do a health screening. It can be a form. We have a My Symptoms app, and we have a link for that on that website as well, which the Department of Health and Human Services created so that your employees can do it right on the smartphone. You set it up as an employer, and they get a number that will link them to you. You're going to set up who gets contacted in your company if they answer that they may have symptoms of COVID. And it also will alert the public health department, which is one of the other pieces required in the health screening that you're supposed to do as an employer. So it's a great tool. It's free, it's easy, and it's going to help you find and remove those employees that may have COVID symptoms from the workplace. Because in a Osha standpoint, the first step is always eliminating the hazard, and that helps eliminate the hazard. The last step is the PPE piece, and there's these administrative and engineering controls in between that you want to focus on. We've also established a hotline for Osha. It's 855-SAFE-C19. Couldn't be simpler, right? 855-SAFE-C19. And that's going to go to a dedicated group of Osha employees. It's not a separate call center. It's right within our staff that are going to take questions related to COVID from both employees and businesses. If you're a business and you have questions about what you need to set up and what you need to do, they will try to help you through that. If they can't, they will get you over to our Osha Consultation team, who I encourage everybody to contact on the business side. Our consultation team is designed specifically to assist businesses in meeting their obligations for a safe workplace. And they do this all across the state all the time. And it may include an on-site, review. There's no penalties. They're not going to fine you or anything, but you do need to correct hazards they identify. If you're an employee calling in, going to be the same process. They're going to work through those questions, and if it's necessary, they'll move you over to a complaint. But the goal here is just to recognize that with so much information out there that we're all trying to navigate responsibly, it's really hard to just say, I have to do this. So we know that everybody wants a place that they can call and just hopefully quickly get some answers, and it's working. Our average call length is about 4.5 or 5 minutes, and that's talking through all those issues. The wait time is about 30 seconds, so it's working really well. If the person you're talking to on that phone line doesn't know the answer, they can get you to either the investigator in the field or somebody else that should be able to help guide you through some of those questions. So this site has posters that you can use. We don't have every poster that's possible, but we do have posters you can use. We have fact sheets for each industry that kind of lay out a couple of pages of the key steps and everything else. There's a link over to the MEDC has a procurement platform for Michigan businesses to help find and utilize and get that PPE that you need, which can include physical barriers, hand sanitizer, face coverings, and other tools. So that is a great resource for you. And we're working through everything as quickly and as efficiently as we can to make sure that we're keeping up with what we're hearing. Certainly, we try to be proactive. We are being proactive, but we don't know everything that's happening every day. So as I mentioned to Brad at the beginning, and for all of you, feel free to give me a shout, send me an email, work through Brad, work through the chamber, whomever, because we want to hear what's happening with the work that you're trying to do to keep your workplaces safe and free from recognized hazards. And we know it's a challenge right now, and we're all learning together. And we'll keep developing tools as we need them, and we're not done yet. What you'll find at that website is not finished. We're still, every day we're coming up with new things that we want to try to get there. But the tools, we're building the tools are there. We can answer the questions, and we respect what everybody's trying to do. And as you're going to hear me say over and over, everywhere I get a chance to talk, no shirt, no shoes, no mask, no service, to get our community to understand that this is how we're going to protect each other and make sure that Michigan stays open for the duration of this crisis.
Well, I guess what you touched on just a minute ago, Sean, leads me to one of my questions here. And I will add, there is an opportunity for you to ask questions. If you have questions, there is a question function within the GoToWebinar program. And so please, submit any questions you might have. And my colleague Devin O'Reilly is monitoring those, and we'll try and get to as many of those as possible. But, Sean, what is your approach and your sentiment as far as enforcement on the OSHA end, my OSHA end, particularly as it comes to COVID? Because we do hear from some of our members, just the thought of OSHA and my OSHA tends to give business people, make their heart race a little bit, particularly at this time. No one wants their employees or their customers to get sick. And so everyone is going to try and follow the rules the best they can. But there is a level of nervousness that even following the rules might not be enough, or that there may be some bad actors out there, within their individuals. Someone, may not wear a mask, and you can't keep on top of everyone all the time. And so what is, as someone who oversees my OSHA, what is your attitude towards enforcement right now?
So my OSHA's attitude toward enforcement really hasn't changed. Unfortunately, my OSHA's been in the state of Michigan. We're a state plan, which means we run our own safety and health program, at least as effective as federal OSHA. We can be better. And the plan is always educate, consult. When we get to the sort of penalty phase, most businesses would be able to start with the consultation, start with calling the hotline, start with doing those things. We believe that, the vast majority of business owners out there are going to try to do everything right. My OSHA is going to look at good faith efforts. They always do, and they always have, to make sure that you are doing everything that you think you should be doing to comply. They will coach you through some of that. If you're making glaring errors, like, for example, you're not providing face coverings to any of your employees, there's no hand sanitizer, I mean, that's a bad actor in the employment space. If you're doing all of those things and your employees refusing to wear the mask, that's a different scenario. As management, you'll have to do what you have to do, right, in that situation. But my OSHA is going to look at each of those pieces individually. So I can tell you that we have had a huge increase in complaints being filed. We are not running around with a hammer. We understand that this is new. This is new for a lot of businesses. So unless you've been in one of those areas like a hospital where you've had heightened standards forever and ever, getting face coverings, where you put the hand sanitizer, this is all new stuff for 90+% of businesses out there. So we understand that. My OSHA will cite employers if they have to, but our goal is to, especially with COVID, educate first, provide these kinds of tools, make sure you're using them, and as long as you're making a good faith effort to comply, that will be taken into consideration.
Now, you mentioned earlier about PPE and procurement. Now, just, I guess it was last week or maybe the week before, we had some of your colleagues from the Pure Michigan Business Connect program in about PPE procurement. I'm wondering if you can touch on that a little bit, because obviously that's going to be a huge issue for employers. It's one thing trying to get a hold of masks, but you even think about, you see the hand sanitizer, machines and those sorts of things. Just trying to get your hands on everything that's necessary is going to be a challenge for some folks. So can you talk about what resources are available for employers to help meet the needs that are necessary?
So I'm glad to hear that you had the folks from MEDC specifically for the Pure Michigan Business Connect, because that's the exact link that we'll have. So before we were willing or wanted to link to that, I did specifically talk with them to make sure that there was capacity within that group of manufacturers they're working with if we see a huge increase in the use of that platform. And the answer is yes. They feel very confident that the group of manufacturers they put together through that platform, and if you are a manufacturer and are making those types of products, you can try to connect with them as well and get yourself on that platform. But they're very confident that we have the tools there that businesses can find and source the PPE that they need, as what, including the hand sanitizer, some of the shields, some of the face coverings, and all that kind of stuff. So as I said, they're very confident that there's enough there for us to use.
That's great. Now, there was yesterday, there was some reporting in Cranes about the potential for what offices might look like as they reopen, and the need for 6-foot social distancing. Now, I know there's already some mention of offices in existing executive orders. Can you comment at all about what offices should look like right now and what you think they may look like when we see a more robust opening of office work?
Yeah, so there's we recognize in every industry there are certain challenges, and in our own office in Lansing, I always refer to it as Cubicle City because we're still in the cubicle world where I'm located. And there are specific guidelines already required within Executive Order 114, which my OSHA guidelines are built on. So we do have one posted specifically for offices, and it includes, realigning cubicles, keeping remote work to the extent practical, that kind of stuff. But even throughout this crisis, all of us, I'd imagine, have some employees that can do a lot of their work at home, but they need to pop in every once in a while. And that's all fine. That's all fine. You keep your 6 feet of social distancing, you wear face coverings indoors, you kind of, we do virtual meetings instead of in-person meetings. But what I like to remind everybody is, this is a public health crisis that has a workplace safety component. So I know that Dr. J and the governor are working on some of those tools right now, and the science is going to tell us what path we have to take. So I think one of the things we want to be mindful of is that, especially for all of you in Detroit, a lot of folks work in a high-rise setting, right? And there's 6 elevators that thousands of people are trying to use. It's not going to be practical for quite some time to start opening up those offices and having those choke points, because you'll see in the Executive Order 114, as well as our guidelines, is in your workplaces, in your businesses, eliminating those choke points where people are going to be forced to be within that 6 feet of social space. So when you're thinking of your office, just keep thinking about what I mentioned about how this thing spreads and why. And you're going to want to think about your office in that capacity. Now, I don't have any more specifics on what the governor and Dr. J are working through as it relates to offices. I can assure you that it's intended to make sure that we're keeping the social distancing, using the face coverings where where we can't. Other considerations within offices and enclosed spaces is ventilation. That as we talk and create these aerosols, opening up your ventilation so you get more fresh air. There are some upgraded filters. You don't have to go to a HEPA, but there are MERV ratings for these HVAC folks that you can go up to that will help remove a lot of the particulate matter that's circulating in the building. So circulation bad, fresh air good, that kind of stuff. So that's probably all I got on that for now, but those office guidelines do exist, and they're going to be covering most of those issues already, or many of them.
Thanks, Sean. I appreciate it. So we've got some questions in the chat room, and I'm not going to make Devin turn his camera on because most of them are looking for links and when we talk about the app and temperature, and there's some concern about privacy for our employees. What should we be thinking about that as people are, submitting, what might be to some be considered sensitive information to employers that could make them nervous?
So when we think about the app is not going to submit anything more to the employer than they passed or failed the health screening questions. The health screening questions are pretty simple. I think there's like 8 of them. Do you have a fever? Do you have any of these symptoms? Kind of the stuff that you've seen out there in the public already. Have you been exposed to COVID? Have you traveled anywhere on a plane where there's an outbreak and that kind of stuff? So an employer from that perspective using the app is only going to see they passed or failed. If they failed, they'll get a notification. There's a little thing on there that says call your supervisor, and then public health will pretty much get the same thing. That, you know, Sean failed his health screening, here's his number, and then they'll start working that contact tracing tool, that piece, to find out who you've been around and that kind of stuff, and then moving you toward testing sites. So we have links to the app on that COVID workplace safety, links to the app, links to those other tools. Temperature screening wise, similarly, right? It's only going to be released. I mean, how private is the temperature screening to begin with, but it's only going to be released to your employer to the extent that you didn't pass that health screening. Thinking about the My Symptoms app is not, there's no geo tracking, it's not tracking locations, it doesn't do any of that kind of stuff. So there shouldn't be too much in there. I would say that one of the links that we don't have in the state of Michigan, because it's not ours, is the EEOC, the Federal Equal Employment Opportunity Commission, has a Americans with Disability app during a pandemic piece that people can check out that talks a little bit about some of that information and how you manage it. Most employers are well aware that, you know, employee information is private, other employees don't have a right to it and that kind of stuff, but there shouldn't be anything overly open on those forms that's going to be a big disclosure of information.
Great. Sean, we appreciate all the time you've spent with us today. Is there anything else that you think that our members should be really aware of and thinking of? You know, I think we're getting to the point where a lot of our members who haven't been able to open to this point are, you know, certainly have to be starting to think about opening back up. There's a lot of folks who, you know, particularly in commercial office space, like we talked about, are probably looking at it. You know, are there any things that we haven't been able to cover that folks should be thinking about right now?
No, I think for now the tools exist for them. I would just encourage everybody to think bigger. We fully recognize that, you know, so many businesses, small businesses, large businesses, we're not designed to be shut down for months, right? We understand that there's financial challenges, there's employee challenges, there's those other things. I would encourage everybody, as they are starting to reopen, to have that dialogue with your employees. Recognize that childcare challenges haven't gone away, that people with underlying conditions may still need to stay out of work, to be flexible with your leave policies, to recognize that we have to be able to get COVID out of the workplace. So if your employee fails that test, or if they come into work and start feeling sick, you know, be liberal and get those folks out of the workplace. Follow the guidelines on how long they should be at home. Check out DHHS. They have a testing a map that people can use to find a testing location near them. So, you know, the tools are getting there, but think bigger, think larger. You know, how are you going to keep your customers safe? How are you going to keep your employees safe? How are you going to manage your space? And all of those tools that you know, that we've put together, as well as all of the great ideas that your folks already have. And, you know, just keep pushing forward. Understand that these face coverings are critical for us moving forward to stay open, to make sure that we contain the spread of COVID and don't have spikes in cases and put more Michiganders at risk. So think big, think positive. We can do it, but we got to commit to these practices to make sure that we do it right.
And one last time, Sean, the website that you referred to that has all of the information that you referred to, I think, at the very beginning of our conversation.
Yep, it's michigan.gov/COVID workplace safety. And if you forget all of that, just Google My Osha, and you can get to there from that site as well.
And we will link to that on the Chamber's COVID-19 website, which is detroitchamber.com/COVID-19, where you will find that and a wealth of information for your business during this crisis. You will find that. You will find this event, as well as all the Tele-Town halls that we've been doing throughout the past 3 months. We hope you find that and all the other information helpful. we thank you for spending some time with us this morning, and we hope that you and yours are staying safe. And we look forward to seeing you again in person very soon. Sean, thank you for the time, and we appreciate it and hope you're staying safe as well. So
yep,
thank you so much, and have a good rest of your day.